Ladies and gentlemen, this presentation is actually a long presentation. I have just few days back, I presented in Jakarta to the Dental Council. But today I am going to present before the medical people. And this presentation actually is to give you a basic things regarding what is the oral manifestation regarding to hepatitis and how you can evaluate the things. It's a big presentation, so I just go ahead without any detailed description. You well know that acute hepatitis is less than 6 months and chronic is more than 6 months. And these are the presentation which changes the liver into this ugly look. These 4 hepatitis are very common, but less common is cytomegalo, Epstein-Barr, and herpes simplex, and yellow fever are very less. While we are talking of the acute type, generally A and E are very common. While you are seeing the chronic type, that is hepatitis B, C, and D are very common in a chronic type. Geographical distribution, if you say, we are at the top, especially in vitamin high at the level with reference to hepatitis A. B, we are just at the moderate level. While we are talking of the C, we are Egypt are at the top. Then we are talking of the D, that is at the high level. Then when we are talking of the E, yet we are at the climax level. And in Pakistan, we will see that the maximum we're finding is hepatitis B is astonishingly more in Balochistan rather than that of any province else. And C is more common in Punjab and Sindh. The main city, they are more involved in this ugly disease. Why? Because we face this type of practice in our routine life. And that is the causes of it. And that is the drugs addict people. And then you see this type of practice of addicted people. It is available not in only one province, it is also in so many areas of Pakistan. Other thing is the low standard living. You are well aware of that. And this is the style which is available in our routine life. And that is reality of Pakistan, which we are looking at. And this is what the dirty, and that is a boy in Pakistan. Then we see unethical practice. And that is not only limited to this type of hakim, but also to the dispensers and circumcision, tattooing, and especially in our most provinces where tattooing is a cosmetic reason. Now I am coming to the dental quacks, and that is what's going on in Pakistan. And even the person is dead, Mushtaq Ahmed Marhoom, and yet he is practicing. Then is like this. Look at the observers, what's given report in a recent June 31, that we are the second most cirrhotic state in the world. And what is the calculation? That the first is Egypt, then Pakistan, and then China. Ladies and gentlemen, this is the histological images which we used to see under the microscope of different hepatitis. The inflammatory lesions and the fat, you will see initial imagination, then it goes to step by step, the hepatocellular carcinoma ends. Ladies and gentlemen, these are the tests which are child classification, which we used to have the assessment, and we go 1, 2, and 3. And we give them numbering of all these grades, and that is how we evaluate. According to CP points, we used to have the MELD, or what you call model for the end-stage liver disease, stage A, stage B, stage C, and we evaluate the lifespan. That is, the first level you can see 100%, and when you come to the C stage, it's reduced to 45 to 35%. Ladies and gentlemen, generally the mucosal lesion which are present in the oral cavity, which is my topic, is a common and less common lesion. This is the research paper which is published recently in 2021, and I have traced this paper shows approximately 230 hepatitis C patient and 150 hepatitis B patient, and they get all these symptoms, which are like this. And step by step, for the general practitioner, I give you the detail which I want to give. And that is the gingival bleeding. First you see what is the parameter of gingival bleeding in hepatitis patient and in the patient which is not suffering from the hepatitis. That is just a routine bleeding, which you see that the gum is absolutely free of any inflammatory lesion. And when we see the studies in 221, you see up to 210, they are less. And as we move forward, the increase in the reports of the gingival bleeding is going on. These are the 4 studies which I mentioned here, from where I have taken the data and my background, and to concentrate that this is the basically the gingiva area, and in gingiva these viruses goes to attack this gingival area, especially on the belt area, and they give the accumulation of the inflammatory cells at the belt level, and that they create a cluster of junk of the inflammatory cells right here. And that way, if you look at this, this is a cluster of the inflammatory cells right there. And if you look more deeply, you see the chronic inflammatory cells, like the giant cell is also present. But they are present just at the top of the gingiva. This is very definite indication in hepatitis patient. That is the look which a gingivitis initial stages give you in hepatitis patient. And that is a very excellent presentation, which is called as the red band gingivitis. Red band gingivitis is a clear-cut indication of a patient suffering from hepatitis. It may be any acute, it may be any chronic, but the response of the gingiva remains the same. Then this gingiva spread back, and then it goes to upper teeth. Then the lower teeth gingiva stands up and move towards the gingiva teeth surface, and the end stage, it covers approximately whole of the teeth. These are the stages which we used to face in a hepatitis patient. Secondly, lichen planus. These are the studies, and you see that here there is liquefaction of basilar basement membrane. There is no basement membrane, and there are just ratty patches here. And these are the cluster of the inflammatory cells present there. And ratty patches right there, you see, they are very, very dissolved and liquefied. On the tongue, you see just posterior surface, it is the start of the white stripes, and generally we people do not see it. And the patient on the first stage see that there is a dipping of the white layer towards forward. Then there is spaces where the whole the keratinization start, and there is start of the ulcers right there. Then these ulcers spreads, and there is no epithelium on the tongue. And later on, their epithelium absolutely gone, and the whole tongue spreads into multiple big ulcers, and that is the result of the carcinoma, which it invading at the end stage. Ladies and gentlemen, on the lip, the same type of the ratty patches, you see the inflammatory phase right there, and it is these are called Wickham striae. These are the net-like structure in initial stages, then they spread into deep tissue, and then they fade away. And after fading, they give a big ulcer type appearance, this is carcinoma in situ, and a definite squamous cell carcinoma is going to. On the cheek, in the initial stage, you will see just a red line. After that, there is Wickham strides, like net-like appearance. This Wickham strides then lead up to the angle of the mouth, and after that, you will see the whole of the cheek is spreaded with a hyperkeratosis. Now, when we see the palate, initial stages on the lateral side, it is there. Then it is going to spread in the mid. Then it is going to involve the soft palate. Soft palate, and then we see the dry mouth, which is very common from the 40 to 60 age of the pupil. And here we see generally the tongue, which is a crocodile type of appearance. And lastly, cyadinitis. This is the enlargement of the lymph nodes and the glands right in the neck. You have to assess it. There is past evaluation in periodontal disease, especially the pocketing is there. Oral candidiasis is very easy to understand for the general practitioner. Initial stage, it is scattered. Then it covers the whole tongue. Later on, it covers the maximum area of the tongue, and there is ulceration. And you see the initial stages of the palate, it is like this. Then it becomes pseudomembranous candidiasis, and this whole slough results into the necrosis of the so these are the less. At the end, I will say that you have to evaluate all the tests very nicely, and especially you will go for the liver function test, not only depend on the LFT, but also go for these protein serum, total bilirubin and prothrombin time. Ladies and gentlemen, I'm thankful to you that there's lack of time. This whole chapter, which I have covered in 1.5 hours, now I have to give it in 15 minutes. Ladies and gentlemen, this is my message that you should go, and it is all dedicated to my very respected and my very dear friend, Dr. Tariq Mahmood Mian. He is really a star in Pakistan, and we regard him and we salute him. Thank you very much. If there is